Hey guys, this is Dr. Joe Borio, and I wanted to, as you saw in the link description, I wanted to talk to you a little bit about that neck pain. Often you get people that get headaches, they're suffering from something that is certainly detrimental really, or certainly diminishing the quality of your life. And it's scary and it's unfortunate. And I think a lot of times, unbeknownst to that person who's suffering, we get into that habit where we start to minimize it and we don't think it's as big of a deal as it is. I think that's a problem number one. I think the other issue is, we think that, and I say this out of love, not out of judgment, we think that, hey, popping a couple Advil or popping a couple of Tylenol or some other medication as an effort to get rid of that pain, we think like sometimes that's going to solve the problem, or sometimes we're too busy to deal with it. So we're like, well, let me just get rid of the acute nature of it right now. And I think what's sad about that, unfortunately, is most people don't realize how significant or serious those problems can be. So think about this. An artery in your heart has to be 80 to 90% plugged in most cases before you'd ever even have a stroke or a heart attack or some type of a cardiovascular event. And what's really common is in the area of the spine. The nerves of the spine can be compromised 40, 50, 60% before you'd ever feel a symptom. So understand that. So just because your symptom, i.e. neck pain, began a week ago, a month ago, a year ago, that doesn't mean the problem began that long ago. Often the problem is years before. So let me go over a real quick case with you. And it's a great case, but this is an individual came into my office and he had neck pain and headaches. So he had neck pain and headaches for on and off for years, and they were getting progressively worse. And he said, hey, listen, I don't want to deal with this anymore. So he went to his family doc, and he had gone to a couple other healthcare providers, and great people. They're trying to help him. And, medicine tries to often utilize medicine only as an effort to solve this problem. And he is just chronically now uncomfortable, getting worse, and now he's on a bunch of medication. Okay? So he comes into my office, and we take an x-ray of him. Now, this is what's interesting in his history. I want you to take a close look at this. When you look at his neck here, and I know you guys don't look at this stuff all the time, right? He's supposed to have, and I'm showing you here on my chart, he's supposed to have a normal neck curve, right? He's supposed to have a normal curve in his neck. So you see how the neck would curve forward, right? So when you look here in these phases of damage, when I'm down way over here, you're going to see a normal curve in his neck. When you look at his neck, you see how that's going the wrong way? That's literally backwards. So his neck, rather than going forward, is now going backwards. And then all these spaces down here are being compromised. All this space up here is being damaged. So you guys know, right, what's happening to the nerves. Think about a nerve coming out of that area of the spine. What's happening to it, right? His spine's bending the wrong way, so I'm pushing on that nerve. So if you think of your brain as like a computer and it's sending messages through these wires, if I start pushing on those wires, those messages aren't going to get there, right? So what's going to happen to the end of that wire? Let's say your thyroid goes there, or your vocal cords, or your immune system, or your heart, or your lung. What happens to the messages that go to that body part? And then what happens to the ability of that body part to send messages up to your brain? They don't get there. The body doesn't work nearly as well as it's supposed to. So that's scary stuff. The other interesting part of this gentleman's history is this. So I asked him, hey, were you a sickly kid? Oh my God, Dr. Borio, I had strep throat, I had a double ear infection. I'm this sickly kid when I'm little, as a baby, as a little boy. Now he's on antibiotics and all different types of drugs, and then he's got some other health problems as a result of the side effect of the drugs he was given when he was a child. Now he comes in his 30s, and not only does he still suffer from some of those side effects, now he's got the neck problem and the headaches and the arm going numb and the whole 9 yards. And again, when we look at this, you're going to see how sick he is. Here's the sad part. Most people don't know how important or critical it is to have your spine checked for misalignment, what's called a subluxation. So most people don't have any idea of how critical it is to evaluate how healthy the spine is. So think about this. If you had a tooth, let's say your teeth line up pretty good, and you had one tooth that was really crooked, that would drive you crazy, right? You would be like, oh my God, look at this tooth. It's driving me crazy. All of them are lined up except for this one tooth. And that's more visual. It's not really going to affect your body dramatically, right? Think about what is happening here when one of these bones, like a tooth, are misaligned, and what it's doing to your nerves, what it's doing to your overall health. Most people don't put it in perspective that way, right? So most of us know, when we look at a chart like this, most of us know our brain tells our body what to do. We get that, right? But we forget the only way the brain can talk to my body are through nerves, and all the nerves have to go through my spine. So often, the reason I wanted to share with you that a neck problem and a headache problem can be much more serious is this. When your spine is sick, it's not only a spine problem or a back problem, it's often a health problem. And we don't necessarily think of it that way. Even though we know all the nerves go through the spine, we don't often connect that when my spine is sick, all these organs get sick, and therefore I get sick. So what we did was, with this individual who came in, we took x-rays of his neck, and that's what we do here at our office, right? We're going to take an x-ray of the spine, and we're going to measure exactly and precisely where the spine is subluxated, where the spine's out of alignment. And then we're going to do a series of adjustments, which are very specific amounts of pressure at a very specific location of your spine in an effort to gently push the spine back into better alignment. That's going to allow the spine to work better. That's going to take the pressure off the nerves, and that's going to allow you to work better. So this gentleman comes in with all these health problems, and here's the good news. Not only is he not having neck pain anymore, not only is he not getting headaches anymore, but this guy's, all his organs are healthier, right? His energy is better. His ability to sleep is better. He had sinus issues that he didn't even think were problems anymore. All of those things get better. Why? Because those nerves that were being choked off here aren't being choked off as much, and as a result, his body works better. So if you're out there and you're suffering from neck pain or headaches, or you know somebody who's suffering from those problems, again, not to freak you out, but often the problem is more significant or more of a concern than you think. And what we do here in the office is the best way to approach it. We're not going to mask it. I'm not telling you never take a pill. I'm not telling you, the medicine's always bad. That's not my point. My point is, what are you doing to make it right? Not mask it. We're not cutting it out, not needling it. What are you doing to make it right so your body can work exactly the way it's supposed to? That's what we do at our office. Listen, if what I'm sharing with you resonates with you, but you're not local, you're not somebody that's in our area, by all means, reach out, message me on Facebook or the link here below, or you can call my office, ask to speak to me directly, and I'll be more than happy to find you a chiropractor that's great, and it's going to take phenomenal care of you wherever you're located. If you're in our central New York area, it'd be an honor to take care of you. It's something I don't take lightly when somebody trusts me with their health. So just hit the link above or below. You can go to our website, Borio Chiropractic. You can call us at the number or text in, and we'd be more than happy to set you up for an initial evaluation here in the office, do an exam, get some x-rays, take a look inside you to see what's going on, and then we can certainly offer you the proper recommendation of care, not only to get you well, but more importantly, to keep you well. Because that's, in the end, that's always going to give you a better life. It's always going to make you healthier and give you a better life. Hey guys, thanks for tuning in. Share and like this video. If you know somebody, just click your phone or whatever you're watching on, share and like this video to somebody, if it doesn't pertain to you directly, that you'd love to see get helped here in our office. Love and appreciate you guys. Talk to you next week.